So the gold standard evidence-based type of psychotherapy for youth depression is a type of therapy called cognitive behavioral therapy, or CBT. So CBT focuses on the connections between our thoughts, feelings, and behaviors. So it's the idea that the way we think about a situation strongly influences the way we feel about it, and then the way we feel about it has a strong influence on the way that we behave. So here's an example from youth depression. Say that I am a child or a teenager and I have this repeated thought that no one likes me. Having that thought over and over is going to make me feel sad, lonely, maybe even angry. Why should I need to make people like me? And then because I'm having that thought and I'm feeling that way, maybe I start to socially isolate. So my thought is like, well, if no one likes me and I'm feeling really lonely and sad and frustrated, maybe I'll just stay at home and I won't text anybody or try to hang out. And then because I'm now isolated, this reinforces my original belief that no one likes me because I don't have opportunities to see that actually it's not so bad. Maybe not everyone likes me, but plenty of kids like me. So in CBT, we're really focusing on understanding these thought, feeling, and behavior patterns, and then teaching children and teens that you can change the way that you think, and you can also change the way you behave to change the way that you feel. So some of the strategies that we might treat children and teens from a CBT perspective include things like behavioral activation. So this is a really well-tested and evidence-based intervention to get kids moving again. So when we're depressed, we tend to isolate, we tend to move less because we're feeling tired and sad and we just want to be alone. But this actually means that kids and teens miss out on really valuable opportunities to feel connected, to kind of get moving, to get outside, and to see that actually there are lots of opportunities to feel a little bit better, even if it's just coming in smaller spurts. We also teach kids and teens in CBT about identifying their automatic negative thought patterns. So when they're in a situation, are they more likely to accidentally either interpret something as being overly negative or more negative than it actually is? And then again, that flows into how they feel and how they behave in that situation. Or are they actually just kind of feeling blue a lot of the time, and so everything feels kind of blah? So can we identify the automatic negative thoughts that we're having? Can we reframe them? Can we try to approach situations in a more balanced, sometimes more realistic, and hopefully even a little bit more positive of a way? And then the third set of interventions that we often use in CBT have to do with relaxation. So how can we teach children and teens to notice when I'm feeling depressed, when I'm feeling blue, I'm having a lot of physical tension in my body, so what can I do to increase my own physiological self-soothing so that I feel more in control of how my body feels? And if my body is more relaxed, my mind is more relaxed, and that helps with mood. For our teens with more severe depression symptoms, there's another type of psychotherapy that has been found to be very helpful, called dialectical behavior therapy, commonly referred to as DBT. So DBT is actually a form of CBT that was specifically designed for our youth who experience really intense emotions, and then often from those intense emotions they experience more emotional or behavioral dysregulation, and then also risky or self-injurious behaviors or even suicidality. And DBT has been found to be very effective at helping teens understand their emotions better, respond to them in a healthier way, and cope with them. So in DBT, we're teaching children and teens how to more effectively move through their daily lives. So often when kids come to DBT, they're experiencing really intense emotions, and that's making things feel really, really hard, whether that's in going to school, being with their friends or family, or doing activities that they really enjoy. And as I mentioned before, these children and teens are often experiencing more severe symptoms of depression. So they may be engaging in self-injurious behavior, thinking about or even attempting suicide. So first, we start with a set of interventions around teaching them mindfulness, this idea of non-judgmentally being in the present moment. So often when we're experiencing emotional distress, we're thinking about the future, we're thinking about the past. And usually we're experiencing a lot of negative thoughts about both of those things, which then of course makes us feel negatively. So how do we slow things down and just sort of live in the present moment to moment, so we're not so overwhelmed by things in the past that we cannot change and things in the future that have not happened yet. We're also teaching kids a set of interventions around interpersonal effectiveness. So often kids who have more severe symptoms of depression really struggle with their relationships, either in getting the support that they need from other people or feeling connected to others in a way that feels really authentic to them, where they can be their authentic selves and be accepted and loved for who they are. So teaching them, when you're having, say, a difficult conversation with someone, or even when you're approaching a friend, what are more effective ways to relate to them to help meet your goals and to build really healthy and satisfying relationships? There's also a third set of interventions that really focus on emotion regulation and distress tolerance. So this idea that when I'm experiencing really difficult emotions, it's hard to tolerate them. Many people have this experience. It's hard to just sit with how I feel. It feels so difficult. Sometimes I don't feel like I can live through it. So how do we help kids kind of slow down in the moment when they're really upset or feeling really intense emotion, how they can kind of get their bodies back on track, root themselves in the present moment, and then work through those emotions and find reasons to keep moving forward and to stay alive. A third kind of psychotherapy that can be helpful for youth with depression is called interpersonal psychotherapy, or IPT. So in IPT, you're really focusing on a person's relationships and how a person's relationships connect to their mood. So thinking together, for example, with an adolescent around what's happening with your relationships. Are they satisfying? Do they feel healthy? Do they feel reciprocal? Right? Where are the kind of gaps in your relationships with important people? And then let's think together on a plan for strengthening those relationships, improving your communication with important people in your life, and then tracking as you're improving your relationships, are you also seeing improvement in your mood and your ability to go out and do the things that you need to do during the week?